Improving urinary urgency, frequency, and urge incontinence. Typically, the bladder can hold urine for 2 to 4 hours, and then you feel the urge to pee. And you should be able to walk to the restroom without having any bladder control problems like urinary incontinence, bladder leaks. But some individuals will have an overactive bladder and feel a sudden urge to pee that comes on very quickly. They may have that "I've got to go right now" sensation, and this is what we call bladder urgency. Urgency is a signal that your brain tells you your bladder wants to be emptied right away. It feels like a strong need to pee that comes on suddenly. Usually it's not expected. It can cause you to pee more often than not, and typically those leaks happen on the way to the restroom. Most times, the amount of urine leaked is only a small amount, but it can be all of the urine in your bladder. Common things that bring on urgency are hearing running water, putting your key into the door of your home, when washing your dishes or your clothing, or just seeing the sign for the restroom. Urinary urgency bladder leaks happen when the bladder muscle starts to contract before you get to the toilet, like in this figure. Urgency follows a wave pattern. It starts, it grows, it peaks, and then subsides until it stops. Frequency is peeing often, usually 8 times or more in one day. Bladder frequency can get worse if you develop a habit of peeing just in case. So you're leaving the home to run a few errands and you pee just in case when you didn't get the urge to pee. And developing those habits over time can contribute to frequency, because with frequency, the bladder never fills completely. It gets used to holding on to a very small amount of urine and giving you the urge to pee sooner and sooner. The key to controlling bladder frequency and urgency is by practicing bladder training, using methods such as urge suppression strategies and techniques to decrease urinary incontinence over time. Urge suppression techniques are a great way for you to take control over your bladder urgency in a few different ways. When you feel the urge to urinate, stop the activity you are participating in and sit down if possible. Try to stay very still to maintain control. Avoid rushing to the toilet. Try and focus on another body sensation. Diaphragmatic breathing, deep breathing are phenomenal. Once you're sitting, take 5 slow, deep diaphragmatic breaths. Think about the air moving in and out of your lungs instead of contracting and squeezing your belly to alleviate some of the pressure externally on your bladder. If you are a candidate for performing Kegels, next start with contracting your pelvic floor muscles, performing Kegels quickly 5 to 10 times. Pelvic floor contractions, Kegels, send a message to the bladder to relax and hold on to the urine just a little while longer. Heel raises, calf raises, pressing your toes into the ground, lifting your heels up high, can be completed standing or sitting, or an additional strategy to suppress the urge that you are feeling. Try your very best to distract yourself by thinking of something other than going to the restroom. Positive thoughts, thinking of a drier climate are all great distractions. The goal is to not rush to the restroom. Repeat the strategies we've discussed to try and suppress the urge. When you feel the urge subside, walk normally to the restroom. You can urinate once the urge has subsided. Unless you are on a voiding schedule, then wait until your next scheduled time. Remember, you are retraining your bladder. Giving into the urge and urinating too early is letting the bladder have control of you. Other techniques to include are mental distractions, visualization, Also, applying pressure over your perineum with a towel while sitting will also help with reducing the urge. If all of the above techniques fail and you still have an overwhelming urge to go, you may use the toilet. Be patient with yourself. Oftentimes, you will need to perform more than one of the urge suppression strategies or techniques before the feeling of urgency goes away. If at first you do not succeed, do not give up. Remember, it takes practice to gain control over bladder urgency, but over time, you will gain more control and have fewer feelings of urgency. However, once you have mastered the urge suppression techniques and strategies, you can now train your bladder. You can begin the bladder training program to increase the time between the initial urge and the time you actually void. You start with following the urge suppression techniques and strategies, but once your urge has subsided, instead of walking to the restroom to void, you will wait a few minutes before voiding. At first, you may only be able to postpone voiding by 1 minute, but keep trying to increase the interval between the initial urge and the time you actually void until you are voiding only once every 2 to 4 hours. Like any new technique, this takes practice and time to master. So we recommend trying this at home initially until you become more successful. When will you see change? Typically, within 3 to 4 weeks, you should see a significant improvement. You should only be voiding once every 2 to 4 hours. Do not get discouraged if you do not see results quickly. Be patient with yourself. Try and avoid fluids that can be bladder irritants. Some chemicals in our beverages can behave as diuretics and bladder irritants. If you are sensitive to these chemicals, they may cause you to make large amounts of urine, or they may aggravate bladder spasms, resulting in a more frequent need to urinate. Some bladder irritants include caffeine. Try to stop or at least reduce your caffeinated beverages like coffee, tea, and cola to see if your bladder control improves. If you tend to drink a lot of caffeine, you should taper down slowly to avoid a caffeine withdrawal headache. Artificial sweeteners. Beverages that contain artificial sweeteners can also be bladder irritants. Citrus juices. Some individuals find that juices such as orange or grapefruit juice can also irritate the lining of the bladder. Do not decrease your fluid intake, as that can increase the concentration of your urine. Try instead to spread out your fluids during the day. Instead of drinking large amounts at one time or gulping down your fluid, try and take small sips of fluid throughout the day. This is especially important before leaving the home. If you get up to void more than once per night, you should try and limit your fluid intake 2 hours before bedtime. Most patients find that pelvic floor physical therapy does help to improve their symptoms. So for further information or guidance, please ask your provider for a referral to start pelvic floor physical therapy so that your therapist can develop an individualized plan of care to address your pelvic floor concerns.